Okay. Good morning. Thank you, Chairman. It is my great pleasure to present this study. So just some disclosure. So there are a number of studies investigating the association between TRLP, LUTs, and also acute urinary retention. Some papers did show that TRLP is associated with high mortality. Some papers show the contrary. While the latest study in the BMJ showed that acute retention of urine actually increased the standard mortality ratio after adjusting for age and comorbidities. So the objective of this study is really to, to determine whether TRLP really leads to a worse survival, and two, whether there's any differences between LUTs and retention and association with the survival, and whether there are any risk factors for survival as well. So for the methods of this study, basically we look into a TRLP database in an 11-year period. We look into the macro records, we look into comorbidities, causes of death, and a total of 3,718 patients were screened. And after excluding some prostate cancer patients, there are 3,500 patients being included in the study. So what it did is basically try to compare the survival between patients who had TRLP with the general population as calculated by the life table method. And then we try to stratify the TRLP patients, whether they're indicated because of retention of urine or LUTs, and try to compare the survival between the two groups. And we look for risk factors of worse survival by use of a multivariate Cox regression analysis. So for the results, basically, this is the Kaplan-Meier curve of the whole TRLP cohort. You can see that the survival of the general population and the whole TRLP cohort is quite similar, and the p-value is insignificant. However, if we stratified patients according to their indications. So firstly, this is the TRLP LUTs hypothetical cohort of the general population compared with the TRLP for LUTs cohort, and it's quite similar survival. However, for patients with acute urinary retention, as shown by the pink curve, it is statistically worse than the general population. And it seems that after around 2.7 years, then the survival curves then tend to separate between them. And we tried to compare the mortality across different causes of death in the different age groups between patients who had TRLP for acute retention of urine or TRLP for LUTs. So basically, we look into a few outcomes: all-cause mortality, the cancer-related mortality, and also the ischemic heart or congestive heart-related, heart failure-related mortality, and also other causes causing mortality. And then we try to stratify according to the different age group. It's a very busy slide, so we'll try to show the significant results only. So basically, for age group 70 to 60, all-cause mortality and cancer-related mortality, there's an increased risk in patients who have acute retention of urine. But then this sort of effects tend to attenuate with increasing age. When we try to look into the risk factors, basically we look into the factors as shown on the left-hand side. And hypertension is a risk factor for a number of causes of mortality. And then old age is a very significant cause for different causes of mortality. And for the subject of interest, acute urinary retention is again a significant risk factor for all-cause mortality, cancer-related mortality, cardiovascular-related mortality, and also other causes of mortality. And just to try to give you some few messages from this study. Firstly, we noted that TRLP is not associated with earlier death. TRLP for patients with acute urinary retention tend to have a worse survival than the general population and than those who did TRLP for LUTs. This observation is more pronounced for young patients, and after adjusting for other comorbidities, acute retention alone still would determine these patients will still have an earlier death in the long run. Thank you very much, and if there are any questions, I'm very happy to answer them. Thank you.
Thank you very much. Now this paper is open for discussion. So please.
Yeah, very quick. Thank you very much. Could you, when you do the paper, could you provide the absolute number? It would be very interesting when you're doing a decision, for instance, for a patient. Do you do TURP or some other kind of new treatments? That how much actually, in average, is the life expectancy in like how many years is a person with acute urinary retention in average going to live. I think it would be quite helpful.
Yeah. So actually we did show the results just now. As patients with retention of urine, it's not like cancer or whatsoever, so the life expectancy is quite long. So even in our curves, as you can see, the survival probability,
Okay, please.
it didn't even reach 0.5 yet. So it's quite long, even more than 10 years. So I still couldn't tell you the exact median survival for you.
Yeah, hello, Saladina, Lucy from Germany. Did you take a closer look of what kind of device you use for the TORP? Did you use, for example, continuous flow resectoscope or high flow resectoscope, bipolary or monopolary or laser resectoscope?
As we, all patients had transurethral resection of prostate. These patients who had laser prostatectomy were not included in this cohort. As to whether they have performed monopolar or bipolar TRP, then we couldn't retrieve that data in our database.
Okay, are there any question? Okay, so thank you very much. We'll finish this session.